Thank you, Governor. Good afternoon, everyone. In terms of the data, as the Governor shared, we have 143 new cases to announce today. We also have 218 people who are currently hospitalized. Of these 218 people, 49 are in the intensive care unit and 35 are on a ventilator. Yesterday, the numbers I reported were 226 people currently hospitalized, 50 people in the ICU, and 36 on a ventilator. The stability in our hospital numbers is an important sign. It speaks to how well Rhode Islanders have been in doing in terms of physically distancing, in terms of wearing masks, and taking the other public health prevention measures into account that the Governor and I have been discussing, because they work. When they work, that's what gives us the confidence to be able to go out into society and get our economy going again. We need to keep this up, even more so when we're in phase 2. For example, we posted the phase 2 guidance for gyms and fitness centers at reopeningri.com, as the Governor discussed. And it's important to reiterate that these guidelines and all of the guidelines are based on common principles for keeping people distanced, keeping people masked when possible, maintaining thorough and frequent environmental cleaning, and sticking to small, consistent groups whenever possible. Those are our core measures for helping to prevent spread of the virus. We want to continue to share them with you. They are continuing to be displayed throughout our guidance points so that everyone can play a role in how we're changing our social norm to adjust and adapt to these changes so that we can live with coronavirus and continue to crush COVID. Other businesses and organizations that are also opening in phase 2 can expect a similar kind of approach. I'll be able to add that everyone can be assured that we are using science and data to directly inform the recommendations that are being given. I want to thank again Secretary Pryor, his team at Commerce RI, the team at the Rhode Island Department of Health, and everyone else who has truly worked tirelessly to pull together this guidance and all of the ones that are thoughtfully done that are on the webpage reopeningri.com. We know that it includes input from business owners who have contributed some incredibly valuable insight. And as the Governor shared, we update that as we go based on the feedback, and always make sure that it continues to be driven by science. We know that the virus, based on studies, particularly one that the Centers for Disease Control and Prevention produced several weeks ago, the virus can travel up to 13 feet distance, which is even more so when you're engaging in vigorous activity or when someone is singing and projecting is occurring. So those are two areas where we are saying you need to distance further apart if you cannot wear a mask because you're breathing heavily or because you need to project while you're singing. Everything that we offer that's based on the best science we can find is really to be able to protect employers, staff, and customers so that we can all get out and have confidence that we're doing it as safely as possible. I'll finish up the day's data update by sharing that we do have 21 new COVID-19 associated fatalities to report today, unfortunately. One person was in their 50s, one person was in their 60s, 3 people were in their 70s, 9 people were in their 80s, and 7 people were in their 90s. As the governor shared, we know that each of these individuals was precious to the families that they belong to, and our deepest sympathies are with the families and loved ones of these Rhode Islanders who have passed away.